All right, I have 11 o'clock, so I think we can go ahead and get started. Hello and welcome, everyone. My name is Kevin Hauer, and I'm with IAAP. I'm joined today by my colleagues Rachel Paul and Samantha Evans, both also with IAAP. And we are happy to welcome you to today's webinar, Digital Compliance in the Healthcare Industry. Today's session was generously sponsored by Deque Systems, so we're very grateful to them for that. And before we get started, I do want to review a couple of technical things with everyone. You should all be connected to the Zoom platform or listening in through the audio. If you are having double audio, that probably means that you're connected via both your phone and your computer. There are a couple of options to deal with that. The first is to simply mute your computer and listen over the phone, or you can hang up your phone and listen via the computer. During the session today, our speakers do plan to take some breaks for questions, so please feel free to enter your questions into the Q&A as we go. We are in the Zoom webinar platform, so there is a built-in Q&A module. You should be able to find it in your Zoom menu. Please put any questions you have in there. If that is inaccessible to you for some reason, we certainly understand. Please feel free to also put your questions in the chat. I will do my best to make sure we get to all of those, although they are easier for us to track in the Q&A. So if possible, please put them in there. And if neither of those options work for you, we will give you a chance to unmute your lines and ask questions verbally during the Q&A pauses. Please just let me know if you would like us to do that. You should be able to let me know in the chat, or there's an option to raise your hand as an attendee. And if I see that at a pause, I will make sure we give you a chance to ask any questions. I also want to remind everyone that this session is being recorded and it will be available for you to review after this session, and it will also be available free for anyone you would like to share it with. So please feel free to direct anyone else to our website to take a look at that as well. So without further ado, I'd like to introduce today's speakers. Again, the topic is digital compliance in the healthcare industry. And our speakers today are Tammy Cosseboom with Deque Systems, Kristina Launey with Seyfarth Shaw, and Mark Stimson with Kaiser Permanente. Thank you guys so much for being here, and I'll turn things over to you.
Great, thank you so much. The agenda for today's call is Kristina is going to go through the legal overview of digital compliance in the healthcare industry. Mark is going to provide a brief overview of the digital compliance initiatives at Kaiser. And I'm going to follow up by providing an overview of how to kick off in the Sustainable Digital Accessibility Initiative based on my experience with working with healthcare industries for around 6 years of my career. So with that, I'm going to go ahead and turn this over to Kristina.
Great, thank you, Tammy. So if we can move to the next slide, we'll jump into the legal background overview. So, none of this is particularly new. There's been a lot going on in litigation with Title III of the Americans with Disabilities Act and with state laws. I'm sure you all have read numerous articles about the proliferation of lawsuits in that space, and what businesses are doing or attempting to do to address it. So it's been a lot of case law development as more companies have been fighting the lawsuits there. In the specific laws that could be applicable to healthcare entities, while Title III of the ADA, we are not talking about that today because it's more general applicability, but while Title III of the ADA does apply to healthcare entities, both plans and providers, to the extent that they are private entities that provide goods or services to the general public, we're going to focus more today on the more specific laws that you don't hear about quite as much every day that are more specifically applicable to healthcare providers. To level set, though, before we jump into Section 508, Title III of the ADA requires that healthcare providers that are places of public accommodation, in other words, that generally provide goods or services to the general public, provide equal access to individuals with disabilities, including providing auxiliary aids and services, and that includes websites and other technologies, as may be necessary to ensure effective communication with those individuals. As most of you probably know, there is no regulation or statute in Title III that says what standard a website has to meet to be in compliance with Title III of the ADA. And that's what's given rise to this huge litigation. So in contrast, something that's actually somewhat nice is when we get into these laws that are more specifically applicable to healthcare entities, you do have more guidance, at least, as dense and convoluted as some of these statutes and regulations are. They do at least tell you what you need to do to make sure that your electronic information technology is accessible in compliance with those laws. So the first one we're going to talk about is not specifically applicable to healthcare entities, but is by extension. So Section 508 of the Rehabilitation Act, if you work in accessibility at all, you know it very well. It's been around for a long time. It was recently refreshed. Section 508 applies generally to the federal government. It also applies to federal contractors and recipients of federal funds via Section 503 and Section 504 of the Rehabilitation Act. And what Section 508 does is it requires the federal government, and by extension those federal contractors or recipients of federal funds, to provide access to information and communication technology to people with disabilities. In other words, to provide accessible information and communication technology. ICT, is not just websites necessarily. It also can be other equipment that the federal agency procures, develops, uses, and maintains. And it's not a policy, it's a regulation, but all of you, it's a statute that also, may have implementing regulations that go along with it. But all of you should have policies to make sure that you comply with the requirements of Section 508 to the extent that you are a federal agency or a contractor or recipient of federal funds. And ultimately, the point of it is to make websites, applications, electronic documents, software, other technologies that can be considered information and communication technology accessible to people with disabilities. On the next slide, we are talking a little more about Section 508, really what I just told you, right? That it doesn't apply to just federal agencies, but if you are a federal contractor, potentially a vendor that sells software to the federal government, an organization that receives federal funding, you need to know about the requirements of Section 508 also. If you aren't one of those entities, you don't need to worry about Section 508. I hear all the time, from private companies, we have to comply with Section 508. And I say, are you a federal agency? Do you receive federal funds? Are you a federal contractor? No, then you don't need to comply with Section 508, but to the extent that the Section 508 rules can provide guidance in providing accessibility, it never hurts to look to them for guidance, but you need to make sure to look to the law that does apply to your company or to your entity. And again, any healthcare provider contracted with the Center for Medicare Services, Medicare and Medicaid, could fall under these accessibility requirements as well. And there are other Medicaid Medicare requirements we'll talk about in a minute also. On the next slide, we will talk about Section 1557. So Section 1557 of the Affordable Care Act came out a couple years ago and was a very big deal because it was, in addition to just the ACA being a very big deal, it was also fairly confusing and convoluted to figure out if you were a covered entity under Section 1557 and precisely what you needed to do. But that's kind of old news now. It came out a couple years ago. Companies or healthcare entities have figured it out. Essentially, though, what the ACA's Section 1557 meaningful access rule requires is that you provide technologies that are accessible. They strongly suggest, and I'm probably going to jump ahead slides here, so I apologize, but they, as well as the Medicaid rules that came out at about the same time, strongly suggest that healthcare provider websites must conform to the WCAG level 2.0 level AA to meet the non-discrimination obligations of those laws. Section 1557 requires that providers of healthcare programs and services that receive federal financial assistance comply with the new requirements of that law for electronic information technology and ensure effective communication through those. Section 1557 doesn't specify a website accessibility standard, but the promulgating agency, the Department of Health and Human Services, said that compliance with accessibility requirements would be difficult for covered entities that do not adhere to standards such as the WCAG 2.0 AA or the Section 508 standards, which, as you all know, I'm sure, now incorporate the WCAG 2.0 AA. And the Health and Human Services Department encouraged compliance with those standards. On the next slide. So here you go. In other words, covered entities under the Meaningful Access Rule, and again, you really need to look at the rule to figure out if you're a covered entity or not. Covered entities are required to make all their programs and services provided through EIT, Electronic and Information Technology, accessible to individuals with disabilities. What I just told you, despite what it says on this slide, is that it doesn't say in the reg you must comply with WCAG 2.0 AA, but as I mentioned a minute ago, the Department of Health and Human Services, said it would be very difficult for you to comply with the law if you did not conform your EIT to WCAG 2.0 and 508, which again incorporates it. The undue burden note here, it's an important note to note that the exception to strict compliance with these laws can be this defense that it's an undue burden to do so. And in other words, an undue burden can be established through showing, that compliance cannot be effectuated without significant difficulty and expense. And the expense portion, they're going to look at the resources of your entire organization. So most companies, most healthcare providers won't even make that argument because it's a really, really high standard, and you usually don't want to have to open up your books and let everyone dig into them and see everything as part of making that argument. And as is noted here, while this was a Title III of the ADA case and not a 1557 case, all of you I'm sure know of the Gill versus Winn-Dixie case, where Winn-Dixie tried to argue that making its website accessible was an undue burden, and the court said, you just spent a ton of money making a new website, so $250,000 to make it accessible is nothing compared to that. On the next slide. So, here talking about the standard, right? And before I guess we move on to this real quickly, just mentioning again, that we have the Medicaid rule as well, which we don't have a slide on, but it came out at about the same time. And it also required essentially that managed care programs have electronic information technology that complies with modern accessibility standards, such as Section 508 guidelines, Section 504 of the Rehabilitation Act, and the WCAG 2.0 AA. So again, very similar to the Section 1557 rule. And it's, interesting to note that just with Section 1557, the point of this definition was to reflect technology advances and to align with the requirements of Section 504 and 508. So there is has been a push to have a common standard here. And the reason why the common standard is the WCAG 2.0 is because they are widely accepted as the go-to standard for digital accessibility conformance. While they are not in Title III of the ADA, they are in virtually every law internationally that has a standard for website accessibility adopted. it's WCAG 2.0 AA that they have in there. That's the standard that the Department of Justice used to put in settlement agreements, that advocates put in settlement agreements, that the few courts that have ruled on the issue under Title III of the ADA also have required for the measure of accessibility. And if you're going to have an expert up on the stand, WCAG 2.0 AA is the standard that they are going to be pointing to measure the accessibility of a website, because it is believed to be the standard that affords maximum accessibility, yet is still attainable. As you all know, WCAG has 3 levels of conformance: A, AA, and AAA. Level A is really, you know, the baseline, you know, it's table stakes. And AA is, again, where you get to where it's still attainable, but it's maximum accessibility. So that's why you should always be shooting for AA. AAA is the highest level, and there are some criteria in there that aren't applicable to all circumstances or all entities. So for that reason, AA, not AAA, is considered the standard that should be met. Although if you can meet AAA criteria, it's great to do so. While, you know, we encourage you all to read the WCAG 2.0 criteria, the shorthand for the principles underlying the WCAG 2.0 and 2.1, which was adopted, gosh, almost a year and a half ago now, is POUR, perceivable, operable, understandable, and robust. So how does this apply to you? We'll get to the point, and then we'll get to the practical implications with Mark and Tammy. So some examples of technology that could be covered under 1557 and Section 508, and, you know, the other laws we talked about as well, potentially: patient portals, medical documents, PDFs, EOBs, EOCs, signing up or administering Medicare, doctor directories, scheduling appointments, really any sort of technology you use to interface with your patients or with your members or potential members. Kiosks is a very important one to remember. Not only is it the technology, but physical accessibility requirements as well. And then again, the final bullet, just general navigation and accessibility of websites and native mobile apps. Also, don't forget any sort of patient informational videos or educational things like that. You know, sometimes those sorts of things fall by the wayside because they might be produced by a different segment of the organization. So, Mark, with that, I'll hand it over to you.
Great. Thank you very much, Kristina. I hope everybody can hear me clearly here. And I'm Mark Stimson. I lead the accessibility group at Kaiser Permanente that oversees many of its key digital properties. So let's go on to the next slide, please. So I'm going to talk a little bit about the history of Kaiser, who we are, and why we believe so strongly in accessibility at Kaiser and what we do here. So, what Kaiser's mission here is we exist to provide high quality and affordable healthcare to improve the health of our members and our communities here. And our purpose really in our accessibility program is to use technology to make healthcare and wellness fully inclusive. And I'll talk a little bit about what that means. Next. So just a little bit for those who don't know about Kaiser, is that we were founded in 1945, and we are one of the United States' largest not-for-profit health plans. And we serve 12.2 million members now. And we're considered an integrated healthcare group, meaning that we are comprised of what's called Kaiser Foundation Health Plan, the insurance part, the Kaiser Foundation hospitals, which include 39 hospitals and 707 medical offices. And then the third part of what we are is our medical groups. And we consist of 23,000 physicians, 60,000 nurses, and 220,000 employees. And again, we're in the United States, and we exist in 6 states: California, Oregon, Washington, Georgia, Hawaii, Virginia, Maryland, and Washington, D.C. Next slide. Great, thank you. So our digital capabilities began very early in the healthcare field, 1996, and our electronic healthcare record system began much earlier than that, and which our website and member-facing portals are connected to our electronic healthcare system. And we have, before the Affordable Care Act, we really started out being a global model for medical communications technology and using that to provide a broad range of healthcare. And after the Affordable Care Act, we grew considerably in this field. So what can our members do? What can our patients do? So they can use kp.org and our mobile app, or what we call our flagship app, and that's both Android and iOS. And our members can email their doctors, they can order prescriptions, make and have appointments, find doctors' locations, view lab results, get their medical records either through the web or through PDFs, and get cost estimates and pay their bills and much more. And we have a screenshot here where we show the member portal here and what you can do. Next slide. So again, we want to use technology to make healthcare and wellness fully inclusive. And we ensure that technology is compliant. So the important thing I want to focus on here is that compliance is not the only reason why we do what we do. We are leaders at Kaiser believe very strongly in healthcare equality and making it equitable. And if we can go to the next slide. So for those who don't know, there's considerable health inequities for persons with disabilities, where persons with disabilities are less likely to get insurance, right, to have a plan. If they have a plan, they're less likely to get diagnosed properly, and they're less likely to be treated properly. And we have a really great quote here from World Health Organization. I'll read out and then paraphrase. Is that people with disabilities are not destined for a life of poor health status by virtue of their disability, but instead it is the lack of support that contributes to the poor health outcomes that we see. So now for those who know about the medical model of disability, right, is that the kind of old medical model is that people or doctors, physicians see disability as an outcome of poor health, right? It's a symptom. But we know that it's also the opposite, that a lot of times people with disabilities then have poorer health or health conditions because of that disability. So it can be circular. And the other thing that we know in just the world of accessibility too, right, is that technology is either a barrier or a bridge. It either makes things worse or it makes things better. And what we want to do is we want to make sure that we can use technology to help improve the inequities that we see. We want to make sure that we dismantle those barriers and that we build those bridges to provide equitable care. Next. So the next slide, it doesn't focus on what here. We want to first focus on features and functionality. How can we make sure that a person with disabilities can get treated and get care more easily? So here's just an example of some of the functionality and features that we have here. So for example, I'll focus on our members and patients who are deaf, hard of hearing, or have speech impairments. So the type of functionality that can be especially helpful is email your doctor, right? We also have online chat with a doctor, and we're always improving our services. So now we have online chat with member services, and we're going to be also having online chats with pharmacies and so forth. Video visits. So now you can have a visit with your physician over the video. Not only can we have 2 channels, that is a video channel, you being able to see your doctor and your doctor being able to see you, but we have a 3rd channel for ASL interpreters to make it much easier. And then appointments online, which Kristina focused on. So instead of making your appointments over the phone, which can be very difficult if you're deaf or hard of hearing, or more difficult, you can make your appointments online. Then some features that are especially helpful for people with visual impairments or print disabilities is we have talking prescription bottles, and you can order those talking prescription bottles online. Online lab results is something we've had for many years, and is very helpful, and of course much easier to read and faster than getting it in the mail. And then digital questionnaires. We have digital questionnaires online that you could fill out before your appointment to help the physician treat you better. And what we've been rolling out more and more are also digital questionnaires on an iPad as you get into the facility. So those are some examples. Next. So now more about reducing those barriers and making sure that we code and test for compliance. So we adhere to WCAG 2.0 AA. And we are looking to, move to 2.1 AA, but right now, officially, we're still 2.0 AA. And we do this, as Kristina mentioned, first with Section 508 of the Rehabilitation Act, Section 1557 of the Affordable Care Act is very powerful. And also, I know that Kristina didn't really talk about the ADA, but that's important to us because we want to reduce the risk of legal action under Title III of the ADA. Next. And just a little history of where we began with accessibility. About 4 years after our website was started, we began implementing Section 508 standards with KP.org in 2000. Then a year later, we started doing JAWS testing and code reviews, mostly done by developers and designers. 2008 is when we moved from the Section 508 standards to WCAG 2.0, and we just started off with level A at first, and then a couple of years later in 2010 we moved up to level A and AA. 2011 officially our accessibility group started and has been growing steadily since then. And then one of our biggest wins is 2016 is building an accessible pattern library, making sure that our style guide and pattern library components are accessible to begin with. And next, and finally, I'll just go over what our accessibility process is for all releases, either new features or changes, is first requirements gathering. Right, so requirements usually with the web and mobile apps and PDFs is WCAG, right? WCAG 2.0 AA. But in healthcare, we have more than that. So, for example, if we're looking at kiosks such as iPads or physical kiosks or wayfinding, indoor wayfinding, we have additional requirements that we look into. Number 2 is that we give consultation and we conduct reviews for wireframes before it gets to developers to make sure that the layout is accessible and is going to be easier to code to be accessible. Third step is we then make sure developers build with our accessible pattern library. And as those developers then implement that and make changes or have to make their own components, that they are able to consult with accessibility experts, accessibility coding experts. And then either developers or QA testers, they first test with automation and with several tools, automation tools. And then after that, we have accessibility specialists for testing, QA testers. And then we use JAWS and VoiceOver and keyboard only. And one thing I forgot to include in here is now we do TalkBack for many of our features. And then finally, when defects are found, as defects are always found, we prioritize those and fix accordingly. So that's our reasoning and our plan and our process for accessibility here at Kaiser Permanente. And it is something that is not finished. We are always trying to improve our process and trying to improve our features and functionality to provide a experience for our members. Thank you.
Great, thank you so much, Mark. I'm going to expand upon what both Kristina and Mark talked about during their presentations. And we're going to start with, where do we start? So how is all this information and where do most organizations start? And this is applicable whether you're a healthcare provider trying to implement accessibility for the first time or augment what you've already put in place, or if you are a vendor who sells primarily or has a really big footprint selling into healthcare providers, because not everybody is creating their websites from scratch, and there's lots of third-party tools out there that can certainly help augment what we're doing in terms of creating sites. Two things to mention is basically public-facing and customer-facing and core service functionality are obviously the first realistic places to start. As websites have become more dynamic and customer serving, they have become our customer retention, customer service type situations where we used to rely on our folks and train our folks on how to make sure that they were pleasant and accommodable to people coming into our places of businesses. Now our websites are actually how we are keeping customer retention and customer acquisition. So very important to keep your customer public-facing content in top of mind when you're creating a project around accessibility. One of the things I'm always asked, and this isn't specifically how it's asked to me, but people look at this as being a project. I have to get this done. I was assigned to do accessibility within my organization. We have a potential product sale into one of our vendors that we've been selling with for years, and now they're asking us about our accessibility. We need to get this done. What does this project look like? And although it can be looked at as an immediate project, the fact of the matter is digital accessibility compliance is a journey. This is something that if it is a core part of your business, or it is a regulation or a mandate, or just the right thing to do, the answer to that question is the journey has to have many components. So you can look at those components as small projects that are happening within the organization, but it is a journey. The first and foremost part of this journey is executive buy-in is vital. And that's where 1557 did play a major role in the elevating the level of programs that were incorporated at the healthcare provider level, due to the fact that it literally called out digital assets. So that is something that really resonated in, because of this, the level of this contract that had to be signed at entities, there was a lot of legal focus. So with that said, basically concentrating on how the journey looks. There's auditing. Some people refer to auditing as assessments. Then there's training. How do you get your folks trained on this? And this is all the way through. This is education, all the way down to the developer or the designer who's actually designing and actually coding the websites. What tools do you have for them to use? What support do you have when there's questions? This is not something that is just a one and done, and it does take some support. And what procurement requirements do you have in place that actually support the accessibility initiatives? Because as I indicated, there's third-party procurement that typically are third parties that support some of your website activities. All of these things have to be looked at and have to be measured. The next part is the digital accessibility program. It's vital to have some type of program, and depending on the size of your organization, this can be one individual, made up of one individual, or it can be several in terms of a larger team. So by creating create a central accessibility team and create and enforce an accessibility policy, so you can report on your accessibility transformation in order to keep buy-in and keep understanding of what the level of of budget that needs to be put around these types of initiatives, really putting together a plan on how you report this out. And reporting these program wins or program graphs out is to the policies itself, as well as how accessible the sites are being maintained now that you've put this program in place. There's a number of factors that need to be reported on. Setting goals is a really good example, and one of the things that I've worked on with many organizations is how do you, this is with a large organization, how do we take a very diverse, multi-dev group organization that everybody works in silos to come up with their portion of what these websites are serving from a customer-facing perspective? Where to begin? How do you start the initiative? And one easy way is, I always talk about crawl before you walk, walk before you run, is really take an inventory of all of your digital web assets as they are public facing, and take a look at those, build out a list, take a good stab at what is the sizing of these sites, put a measurement to them. I put an example here of extra small, small, medium, and large, and conduct what I would call a mini assessment, or some small amount of testing that includes automated testing as well as manual testing. And the reason why you would have this type of information is because this will help you understand how compliant an actual site is. Now, this is just what I would call or refer to as a sniff test, but this helps you have metrics to start putting together the greater plan in terms of prioritization and different levels of support, and talks with those those portions of the web owners. So having partners and communicating internally is super important and vital to the success of any accessibility program. So meet internally with the site owners, let them know about the initiative, let them know about what the policies are and what the goals are of the organization in order for them to get to a compliant state. Give the teams accessibility coaches. If you do not have resources internally, make sure you're using outside resources. Make sure that when you're using outside resources that there is an understanding that of what level of self-sufficiency you're trying to gain and where you're trying to achieve within a period of time. Execute on ongoing empathy campaigns. This is really important. This has to stay top of mind within the organization. Publish learning resources and bulletins. Make sure that every once in a while you're getting accessibility back out there, and leverage tools to support the roles in efforts. So you can basically, each role has a role to play within the organization about how they can create and maintain accessible content. Make sure they have the right tools and information to support them. Prioritization is really a key to talking about putting together that large grid of an inventory sheet and doing some sniff test or small type test. And that would allow you, based on how those test results come back, you can actually put together a rating scale and rate each of those sites. And what that allows you for is an understanding, depending on the rating of each site, and also the metrics on your analytics that you're using on your web analytics, to make sure that you're also identifying those sites that are most widely used, because obviously those are risk factors. You can then start putting together the plan for who is going to be first up for more comprehensive testing, and a plan on how that group within the organization is going to bring their site into compliance and at what time frame they have to do so. And I've seen this work very successfully when all of the other things that were mentioned before this are in play. One of the factors that needs to be on the sort of the plan, or the individual plans for the individual web assets, is the site going to be going through a redesign, or is the site being a new site replacing it in a matter of time? And those are all key areas to understand, and that doesn't mean you check the box and say you can deal with those later on. What it means is this is a very, it's a way for you to have a cost-effective manner to get in early, or as DQ refers to, shift left, where you can actually provide your designers and developers with tools so they can start getting compliance or educated on compliance and understanding the level of compliance at each process of what they're doing. So getting into that design area, making sure there's making sure that they've actually are using either in-house resources that have accessibility expertise to review them and give them guidance, maybe even writing stories about how accessibility is a core focus of this particular design. Style guides have to be reviewed to make sure that you're not starting out of the gate with color contrast issues. And you can either do that through internal resources if you've gotten the accessibility expertise built up, or you can leverage outside resources to help support these initiatives. But the more you push this or shift left this into the development cycles, the more you are going to have less cost later on as the manual testing is introduced and you're creating fixes or issues that developers can fix. Those will be much less if you're incorporating some type of automated testing and assistance at the design stage. And this is really important because making sure that developers have a clear understanding of getting a design and how they code, how they're doing coding against that design with accessibility in mind is going to be a key area of focus in terms of making sure that you're maintaining and developing accessible compliant code. Many of the topics that I've outlined today and have been outlined can be found in Dylan Burrell's book, Agile Accessibility Explained. Dylan is the Chief Technology Officer here at DQ, and I am super excited about this book. It really brings to light what all the aspects are in terms of how you incorporate compliance throughout that shift left process. Also, how you instill and implement an accessibility evangelized manner throughout your organization in terms of putting a good accessibility compliance program in place. So I do encourage you, if you have the time, to look that up, because it is it's very, very informative. So I did mention briefly about selling into the healthcare and wondering, how does this apply to me and why is this important? Healthcare organizations rely on third parties. I see this every day. I talk to folks about this. The third party components are really important because if you haven't noticed, a lot of the healthcare providers that maybe you've been selling into for years and have contracted with are now asking you for accessibility statements and asking you what your level of compliance is. They might even be asking you for a voluntary product accessibility template, or VPAT for short, or some are just asking for WCAG conformance statements. And this is something that might be new because you've had to check the box when you've been in procurement before that your product is accessible, but you've never been asked to prove it. And this is becoming more and more common in the marketplace because it is vital for healthcare organizations to maintain accessible web properties, and that means even their third-party components. They can't just say that's third-party where we don't need to make that accessible, because the third-party component might be very interactive with their customers. So this is something you're going to be seeing more and more. Digital requirement language are in contracts, and a lot of existing partners that have been doing business with healthcare providers for years are being asked to put in a plan in place or be giving a timeline on when they need to provide a conformance statement or where they're at from their accessibility compliance initiatives. So one of the business aspects of this is taking a strong look at who your organization, if you are a third-party vendor, if you're a software vendor or a component vendor, you really need to take a strong look at where your level of compliance is and be prepared from a competitive standpoint to present some type of conformance documentation on solicitations. So in closing, one of the things that you're probably gonna, you've probably already recognized through this is digital accessibility compliance now is not just websites, right? We talked about kiosks, we touched on native mobile apps. That's the second area that we're making it very convenient to do business with, having native mobile apps. I don't know how we ever lived without being able to do things through an app on our phone, but that's become commonplace now. All of these need to be need to be assessed and be compliant in order to meet the regulatory requirements that we've discussed today. I would really encourage the way that the legal landscape has happened around digital accessibility. There has been many organizations that have come into this marketplace. I really encourage you to take a really good look at the vendors that you're going to work with. Make sure you know how long that they have been doing this. Is this their core competency? Size of the organization, and what I always refer to as the bench strength. What are the folks on the bench? What is their expertise and experience? That's something that I really encourage to find out. This is all things that we do in our normal lives when we're trying to choose products or choose services to use. This is really critical in this digital accessibility space. And how scalable is the organization in terms of the support? Are you looking for support to get you started, to get you launched, but you want to become self-sufficient? What is their processes and what do they have to support you in doing so? So those are things that I really think that are vital. And of course, I would be remiss to not talk about the staff with certifications, IAAP certifications. This is really critical to make sure that the organizations you work with do have a level of IAAP certified employees on their staff, both in both certifications. And with that, I would like to open it up to any questions that the audience may have.
All right, thanks. We have a couple of questions already queued up. We've answered two in text already, but I just want to make sure everyone is aware of that. The first question was, for Kaiser Permanente, are the accessibility design consultants and the accessibility coding expert groups you work with externally, or are they internal groups you have assembled? And Mark did answer that. He said both. We have internal and external groups. We had another question about the slides for today's session. Those will be distributed along with the recording to all attendees today, and they will also be available for download on our website for anyone who registers for the archive after the fact. So yes, you will get a copy of the slides. And now we have a number of questions queued up in the Q&A. The first question, how might accessibility laws and requirements apply to healthcare providers that are also a branch of a public university or similar institution?
Well, this is Kristina. I guess that one's probably for me. You always need to look at what type of entity you are to figure out what laws might apply to you. So if you are a public university, then you are going to be subject to Title II of the Americans with Disabilities Act, which applies to state and local public entities. You might have Title III apply to you if you have any sort of private coffee shops or other private entities that operate out of any of your property. You know, unlikely that would extend to electronic information technology, but it's a possibility if there's some sort of public-private venture. To the extent that you receive federal funding or are a federal contractor in any way, then Section 508 would apply to you and its accessibility requirements. And then if you have a medical branch to you, for example, so you have a hospital associated with the public university, then you quite likely could have the requirements of the Medicare or Medicaid or Section 1557 that apply to you. We would just need to take a look at those and find out if you are a covered entity as defined by those rules. But the bottom line is, as we talked about earlier, that even though, Section 508 and Section 1557 and the Medicaid regulations all really do, as part of the regulations and statutes, require conformance to WCAG 2.0 AA, and Title III and Title II don't. Essentially, the way the case law has been going, if you want to ensure that you are in compliance and take the take the least risky approach with all of those laws, then conforming your EIT to WCAG 2.0 AA is the way to go.
All right, and our next question for Mark, how do you deal with third-party widgets like Google Maps, YouTube Video Player, payment systems? For instance, do you fix Google Maps' unusual tab order, or do you ensure controls meet contrast requirements?
So let me answer this in a couple ways. So first of all, we do ask for an accessibility conformance report, completed VPAT, prior to purchasing, and as part of a proposal when we're looking at vendors, we want to make sure accessibility is part of the contract, so that if defects do occur in the API, that they fix them, right? So that's step one. Then the second thing is like what you said, Google Maps, weird tab order. We really take it as a case-by-case basis. If we can log the defect with the vendor, we do that. And sometimes it's just not as easy to do. It's just really a case-by-case basis. But we believe that we own the risk and we own the responsibility on our site, regardless of whether or not we bring in a vendor or not. The vendors do make it more complicated. I hope that answered your question.
All right, I'm going to jump over to the chat for a moment. We had a question, Mark, this was for you regarding your list of steps. For step number 6, do you use a VPAT or perhaps the trusted tester methodology?
Yeah, a good question. So trusted tester. So since we're not the federal government, we don't really rely on that that methodology of trusted testers. I mean, we're fine to bring on trusted testers, but we don't require it, and we don't really use the VPAT method as well. We have a testing grid and that we use, and the goal of that is to find defects that truly exist. And either we find that through automated means, by code sniffing, through manual testing, like I said, with JAWS or VoiceOver or TalkBack or keyboard only. And so we use various methods to see if the defects really exist. And then we just log it in Jira and track it. So the answer is kind of neither for us. Thank you.
We had 2 very similar questions come in for Tammy. What are some examples of empathy campaigns, and can you explain a bit more about the empathy campaigns?
Sure. So we get this question a lot, and it's sometimes there's a little mixed reaction within the accessibility communities in terms of the groups that DQ, but there's a difference between sympathy and empathy. And empathy is really showing folks what it is, why they're asked to code in a certain way. So DQ has created empathy labs where we have multiple stations where we do certain exercises with folks to show them keyboard only use, to really give them an understanding about why these accessibility standards were put in place and what they're trying to achieve through a variety of different disabilities. It's not just the disabilities that you might think about in terms of low vision or hearing or persons with a disability such as sight. So we really try to emphasize the fact of keeping things top of mind. So the empathy labs are one thing that we have really evangelized and have conducted throughout the country. And the other part of this is it could be as simple as making sure that you have a newsletter that is distributed internally within your organization that just speaks to one specific subject about digital accessibility and why it's important and what the user story is behind why a website should work in that manner. And it's just keeping the education and the knowledge and the empathy going so they understand that what they're doing has a purpose.
Our next question is also for Tammy. Can you please repeat the name of the book that you mentioned?
Sure. I can actually, I'll bring it right up on screen. It is called The Agile Accessibility Explained, and it's by Dylan Barrell, B-A-R-R-E-L-L. And it's a practical guide to sustainable, accessible software development.
Next question. As a third-party vendor, how do we approach our current healthcare clients about turning the focus to accessibility when it's not been a focus before?
And I'm going to take that for the first part. So part of it, I believe, is a competitive advantage. So if you are selling into your vendor that's selling into, one of the things that it would come top of mind to me is, as a competitive advantage, you could also bring up the fact that you are working towards compliance, and this is your compliance state of your application or your component or your solution. Mark, would you have any other take on that?
Yeah, I mean, we used to get that question a lot from our vendors, and we don't get it much anymore because I think that it's just, as you're saying, Tammy, it is becoming more prevalent. And so we used to say, if other customers are not asking for this now, they will be, and I think that's the case of what's happening. And we're very fortunate at Kaiser Permanente because of our size and our purchasing power. So, we can always just say, well, that this is what it's going to require, right? If you want to purchase from us. But for smaller customers, I think it's really just to emphasize what you said, is that this, if you haven't seen it now, you will see this. And it's important not just from a compliant aspect, but from this is the purpose and mission of many people in healthcare. Right? They want things to be inclusive and equitable. Thanks.
All right, I think we probably have time for one, maybe two more questions. If we don't get to your question, I will make note of it, and we will pass it along to Mark, Tammy, and Kristina, and make sure that they can get back to you with an answer. Next question is, does the text of section 1557 use the term modern accessibility standards? Is there anything in the language that makes it clearer some standards should be used compared to the language of section 504 or ADA Title II or III?
Okay, so you caught me with not having the actual regulation up in front of me. So I would need to go back and check it just to see what it says exactly. But I do know from my summary memo I do have in front of me that I use that breaks down section 1557 into plain language, that section 1557 does not specify a website accessibility standard. It doesn't say, to comply with section 1557, you must conform your website to WCAG 2.0 AA. So what we have looked to, in the absence of super crystal clear language, is what the agency that put forth the regulations said, and that's the Department of Health and Human Services. And it said that compliance with accessibility requirements would be, I'm quoting this, difficult for covered entities that do not adhere, and I'm quoting again now, to standards such as WCAG 2.0 or the Section 508 standards, which now incorporate 2.0 AA. And then I quote again here, the Department of Health and Human Services encourage compliance with those standards. So it doesn't, expressly state a standard, but it does through the Department of Health and Human Services statements essentially, say if you're going to comply with 1557, you should comply or conform to WCAG 2.0, AA, and 508.
All right, we'll take one last question, and then the rest we will do via email. Do you use different personas to come up with user stories to personify disability requirements within your Agile product backlog?
If that's a question for me at Kaiser, that is something we're working on right now at building as a current project. We are seeing that is in high demand from our designers, and it's very powerful. So I'm looking forward to using that. But I hear more and more about how powerful that is for those that own the products, build the products, and design them. Thank you.
All right, Tammy or Kristina, anything to add to that?
This is Tammy. I think that would be a great follow-up discussion.
Mm-hmm.
All right. It is 12 o'clock, so we are out of time. Thank you so much to Tammy and Kristina and Mark. This was a fantastic session. And thank you also to AI Media for providing captions today. And then one final huge thanks to Deque Systems for sponsoring this webinar and making it available for free to all of you. So thank you for joining us. As I mentioned, the webinar was recorded, and we will make that available to all of you who registered for the live session, and we will also make it available as an archive in our library. And for those of you who still have questions in that haven't been answered yet, I will pass those along to the team today, and they will be able to get back to you on those. Some are more specific to you, so we will send those responses to you directly via email. We'll be able to pull that from your registrations. For those of you whose questions are more general, we can always post those on the information page for this webinar so that everyone can see them. Thank you again for joining us, and everyone have a great day.